Hello, I'm Dr. Amy Schreibman. I'm a nurse practitioner and a doctor of nursing practice. Welcome to Medical Minutes. Today we're going to talk about otitis media or middle ear infections. A middle ear infection is also called otitis media. This occurs when a virus or bacteria causes the area behind the eardrum to become inflamed. This condition is most common in children. Most middle ear infections occur during the winter and early spring. Often middle ear infections go away without any medication. However, you should seek medical treatment if the pain persists or if you have a fever. There are two types of middle ear infections: acute otitis media and otitis media with effusion. Acute otitis media comes on quickly and is accompanied by swelling and redness inside the ear. This can be seen by your healthcare provider. Often fever, ear pain, and hearing impairment occur as a result of trapped fluid and/or mucus in the middle ear. Otitis media with effusion occurs after the infection goes away. Sometimes mucus and fluid will continue to build up in the middle ear, and this can cause the feeling of the ear being full and affect your ability to hear clearly. To determine if you have an infection, your healthcare provider will use an otoscope to look in your ear. Common symptoms for an ear infection include ear pain, irritability, difficulty sleeping, tugging or pulling at the ears, fever, yellow, clear, or bloody discharge from the ears, loss of balance, problems hearing, nausea and vomiting, diarrhea, decreased appetite, and/or congestion. Treatment depends on the severity of infection and the ability of the patient to tolerate antibiotics. Symptoms lasting more than 3 days usually mean your doctor will recommend antibiotics. However, antibiotics won't cure an infection if it's caused by a virus. Some complications associated with middle ear infections are infections that spread to the bones of the ear, infections that spread to the fluid around the brain and spinal cord, permanent hearing loss, and/or ruptured eardrums. So it's key to seek early treatment. Preventing ear infections is the best way to avoid them for both adults and children, so you should wash your hands and your children's hands frequently. If you bottle feed, always hold your baby's bottle yourself and feed them while they're sitting up or semi-upright. Wean them off the bottle and pacifier by year 1. Avoid smoky environments and keep your children's immunizations up to date. If you have any questions or comments on what we discussed today, please leave them in the comments section below and we'll get back to you. Remember to follow us on Facebook or on our website, The Boca Voice. I'm Dr. Amy Schreibman, and we'll see you next time on Medical Minutes.